Hello. Sorry to keep you waiting. Dr. Alix is very busy today, but she's ready to see you now. Are you ready to go inside? Yeah, you can take your belongings with you. Okay. Yeah, just follow me right this way. So you can go ahead and have a seat right there. Dr. Alix will be in just a moment. Just first tell me some of your symptoms so I can write it down for Dr. Alix. Okay. Cough. Sore throat. Do you have a fever? Okay. Then I'll have her check that. Any other symptoms that you're feeling? Okay. Well, I'll leave this here for Dr. Alix then, and she'll go over anything else you might have concerns about. But that's it for us. Did you have any questions for me before I head out? Okay. Well, I'll leave this here for Dr. Alix again. So, I hope you feel better. Take care, okay? Bye-bye. Can I come in? Hello, I'm Dr. Alix. It's nice to meet you. What seems to be the problem today? Okay. And do you have a fever? You're not sure? Okay. But you're feeling feverish? Alright. I'll check your temperature. We'll make sure that you don't have a fever, otherwise you might have the flu, but checking your temperature will give us a pretty good idea if you do or don't. But before I go ahead and get started with that, is it okay if I ask you some questions? Okay. Are you currently taking any medications? And what is the name of that? Okay. And what's that for? Okay. And is that prescribed by a doctor? Okay. And are you having any issues sleeping? How many hours of sleep do you get a night? Okay. And have you seen a doctor about that yet? Okay. Well, you should be getting at least 8 hours of sleep a night, 7 at the lowest. So I do recommend getting more sleep, but if you're having trouble with that, I think we should pinpoint where that trouble is occurring so we can fix that. How many hours of screen time do you get a day? Is your job sitting in front of a computer? Okay. Yeah. You know, being on the screen for too long can really stimulate your brain too much, especially if you're on your phone or computer right before bed. It probably isn't good for your sleep, unless you're watching something relaxing maybe, and lowering the brightness. That could help. Some other issues that might be affecting your sleep could potentially be your diet and exercise routine. May I ask if you've had any changes to your normal diet recently? Okay. Right. Well, we want to make sure that we're not eating too many processed foods. We want to stick to whole foods, fruits and vegetables, and whole grains, okay? Right. Right, I know. But, you know, I think it could really help with your overall health, and especially with sleep. Not having sugar right before bed might help as well. And what about exercise? Do you exercise regularly? Would you say that you're at least getting 30 minutes a day of exercise? Okay, well, I would encourage you to at least get 30 minutes of exercise a day, whether that be walking, swimming, running, jogging, any form of exercise would be completely fine. Yes, even walking, anything to really get your heart going. It doesn't need to be too strenuous. Walking is really good for your heart health. Okay, good. And how many cups of water are you drinking per day, if you'd have to guess? 4. Okay. We want to make sure we're at least getting 8 cups of water just for overall health and to prevent dehydration, okay? Yeah, it does seem like a lot. It really helps if you spread it out throughout the day, you know, so you're not drinking it all at once and trying to keep up at the end of the night. Yeah. And if you're having trouble sleeping, you might want to really get your water intake in before nighttime so that you're not getting up in the middle of the night to use the bathroom. Okay. And have you had any skin issues at all? Bit of dry skin on your scalp? Okay, is it, can I take a look at it in a moment, actually? Yeah, I'd like to take a look at that, but I'll finish these questions first. Have you had your flu shot yet? No? Okay. I really suggest getting your flu shot. The flu is going around right now, and we really want to make sure that people have their flu shots so that they keep themselves safe and others too. Were you looking into getting your flu shot? Okay. We can set that up for right after this appointment, actually. I can have the nurse come in and I'll order the flu shot and she'll give it to you. Would that be alright? Good. I'll send that note to the nurse and to come in. And did you have any questions before we go ahead and get started? No, the flu shot shouldn't hurt. It'll be okay. Alright, I'll go ahead and get started then. I'll just sanitize my hands quickly. So, when did you start feeling this sickness? Okay. And do you live with anybody or do you just live alone? Okay. And are they showing any signs of illness? Have you been traveling at all recently? Okay. Was that out of the country? Okay. Go ahead and get started by taking your temperature. So, if you could go ahead and open your mouth for me and lift up your tongue. I'm going to place this right under and go ahead and close your mouth for me. And we'll just wait one moment and read the temperature on there. Okay, thank you. Well, it looks like your temperature is normal, so there's no fever, so looks like it's not the flu, so that's good. Are you having any trouble breathing? No? Okay, that's good. Well, I still would like to take a listen just to make sure. So, I'll just come a bit closer to you. You could go ahead and take a deep breath in for me. And out. And in. And out. Okay, I'll check the other side. Again, breathe in for me. And out. And in. And out. Okay. I also need to check your back. So again, go ahead, breathe in. And out. In. deep breath in and out and in and out. Great. And can you just go ahead and breathe normally for me? Okay. All right. Okay. Everything sounds normal. Yeah, it just started raining just a little while ago. The weather is constantly changing today. I'd also like to go ahead and take your pulse. Can I have your right arm, please? Thank you. So I'll just time this. Okay, just relax for me. Thank you. Okay, thank you. Everything seems normal with your breathing and your heart rate, so that's good. And if you can open your mouth for me again, I'll check the back of the throat. Okay, just get a look at the back. Okay, I am seeing a lot of redness, and I see that you haven't had your tonsils removed. Have those been bothering you at all? No. Okay, just let me get one more look. Open. Thank you. Okay. Yeah, it seems to be fine. Yeah, but there definitely is some inflammation at the back of the throat from what I can see. Are you having trouble swallowing? Have you lost your sense of taste? Okay. Alright. And does it hurt to eat at all? Okay. Alright. Well, it definitely could be an infection at the back of your throat, but I won't be too sure. It could be strep throat. I think I should order a test for that just to make sure that it's not. I'll have the nurse do that. And also I would like to check your lymph nodes, see if they're swollen. So I'm going to be placing my hands on your neck, okay? Okay. Just feeling around. Usually you can tell if they're swollen. There'll definitely be sickness. Yeah, it's usually a pretty good sign that you have sickness if your lymph nodes are swollen. And they are definitely swollen. So, yeah. Have you been missing any work or school with this illness? Okay. I could get you a note if you need that. One of the nurses can write it up. Okay. Well, since you do not have a fever and you have the cough, the sore throat, and you have congestion as well. Well, it sounds to me like you just have the common cold. Right, if you had a fever, I would suspect it'd be the flu, but since there's no fever, I suspect a common cold. But again, it could be strep throat, so once we have that test done, we'll know for sure. Okay. Is there anything else you think I should have any concerns about? You're having headaches? Okay, how often? And how long has this been going on? And how long do these headaches last? Okay. How often are you getting them? Oh, okay. Are you sure they're not migraines? Are you sensitive to light or sound when you're having these headaches? Yes, okay. Have you taken any medication for that? ibuprofen. Is that helping at all? No. Okay. Well, I'm not specialized in that field, but I can go ahead and schedule an MRI for you. And if you'd like to see a specialist for that, we can figure out where those headaches are coming from. It might just be because of the sickness, but since this has been going on for a while, I think it might be something else. It might just be a case of chronic migraines, but again, I wouldn't be the one to speak to you about that. Yeah, I can go ahead and schedule the MRI. Yeah, we can do that today. Let me just write that down in the notes and take it off. Have you had any traumatic injuries within the past year? You fell and hit your head? Okay. What did you hit your head on? Concrete. Okay. And when was that? Okay. Yeah, then we should definitely get the MRI, just to make sure that there was no brain damage when you hit your head. You didn't see a doctor after that? Okay. Yeah. We'll order that for today then. In the meantime, I can prescribe you some naproxen. It's pretty much ibuprofen, but it's a little bit stronger. It might help with the migraines. And if it doesn't help, you can tell the neurologist when you see them. Okay. So, oh, and the skin issue that you had on the scalp. Would you mind if I take a look at that? Okay. And when did you notice this skin condition on your scalp? Okay. And go ahead and tilt your head forward for me. Thank you. And I'll sit behind here, behind your ear. Oh, okay. Yeah. Let me get a closer look. So, it does appear to be red. Have you been scratching it at all? Okay. It's on the other side too. Okay, let me take a look at that side as well. Okay. Oh, yes. It's a little bit worse on this side. And you haven't been scratching it? Okay. Well, no, it doesn't look like dandruff. What it actually looks like is psoriasis. Do you know what that is? Okay, it's when you have really itchy, flaky skin. I'm not a dermatologist, but I can refer you to see one about that. I think you could be prescribed medication for that could really help. What kind of shampoo are you using? And how often are you washing your hair? Okay. Well, I will get the nurse to set up an appointment with a dermatologist. Is that alright? Okay. We'll see them about that so we can get that issue resolved as well. So we have the appointment with the dermatologist. We'll get the strep throat test and your flu shot and an MRI. Yeah, you'll see the dermatologist. They probably won't be available today, but maybe sometime next week. Yeah, you can ask the nurse at the front desk. Great. All right. Well. So since I believe that you just have a common cold, you can take any over-the-counter medicine for cough and cold, throat lozenges, cough drops, those help as well. You can find those in the pharmacy. Besides that, I would say keep taking ibuprofen or Tylenol to help with the sore throat as well. Yeah, there's not much else we can prescribe. Yeah, it should go away in a few days. It might last up to a week, but that probably won't be likely since you've had it for a while now. It should go away on its own. Yeah. Yeah, the medicine will just relieve the side effects. It won't cure it though. Okay. Yeah, but there's no need to worry since you don't have a fever. So the only thing that it might be is strep throat, and you should get the results for the strep throat test later this evening. And if you do have it, we'll give you a call. And if you don't, do you have the app? Yes, okay. A notification will be sent to you via the app. So you'll get the results there. Okay. But besides that, it looks like everything is pretty good. And I hope you get all these issues resolved. It's really good that you come to see the doctor, whenever these issues arise, so that we can treat them as soon as possible. So thank you for being proactive and coming in today. Okay. Alright, well, I'll send in the nurse for the strep throat test and your flu shot, okay? Yeah, and then you'll see the nurse at the front desk, and she'll tell you where the MRI testing center is. Okay. All right. You take care. Bye-bye. Hello again. How did everything go? Yeah, I see here that I need to check for strep throat, and you need your flu shot. Yeah, they always get you with the flu shot, every time you come in, they tell you gotta get it, and it is really important, but, patients are always just so surprised by it, but you have to get it every year. Yeah, it's good for everyone. Yeah, it seems like it's just started raining out there. There's even some thunder as well. I know. It's an interesting day we're having with the weather. Gonna put my gloves on. Actually, before I get these gloves on, did I take your blood pressure? I don't think I did. Yeah, I didn't. I need to take that. Just get this here. Can I have your right arm, please? Thank you. Just wrap this around. And it's gonna get a little tight, okay? Alright, looks about normal. That's good. Yeah, I was supposed to get that before and I forgot. So I'm just going to put my gloves on now. And I also need to put on a face mask. Don't be alarmed. It's just standard procedure for when I do the strep throat test. Have you ever had a strep throat test before? No? Okay. Well, I'm just going to take these cotton swabs and I have to wipe the inside of your mouth and then the back of your throat as well, okay? So if you could open your mouth for me, thank you. And stick this in there. And wipe the inside like so. And the other side. Okay. And then, so this is gonna go at the back of your throat now. It's gonna be a bit uncomfortable, but just keep your mouth open for me, please. Thank you. And it's gonna go in right now. I know it's a bit uncomfortable. Sorry about that. Just gotta get one more. Keep your mouth open for me real quick. Good. Thank you. Sorry about that. I know it could get a bit uncomfortable. And now I'll also give you your flu shot. So if I could again have your right arm, please. Thank you. Let me find a vein here. you could flex your arm for me, please. Thank you. Alright. Okay, are you afraid of needles? Yeah, me too. No, I don't mind giving them, but not on myself. I don't like it. But it's just gonna be a little prick. Nothing to worry about, okay? Here, I'll count down from 3, okay? Alright. 3, 2, 1. Okay. Are you feeling okay? Do you need to lie down? Okay. Do you need a cup of water? You're good? Okay. Alright. It's always good to know, you know. Yeah, I definitely have had some people pass out before. Oh, you'd be surprised. Yeah. People of all ages, all sizes. Yeah. Okay. Let me get you a band-aid for that, actually. It seems like it's bleeding a little bit. Yes. Go ahead. I'll put this on. Alright, well, it looks like the doctor also wanted you to get an MRI and set up an appointment with a dermatologist. Is that correct? Okay. The nurse at the front desk will take care of that. She'll let you know where to go to get the MRI, and she'll set up the appointment for you for the dermatologist. Okay. Well, it was great meeting you, and I hope you feel better. You take care, okay? Alright. Bye-bye.